and in succession to the videos what I have been taking up in pharmacology. So today's video I'll be mainly discussing upon the anticholinergic drugs. So in this video I'll be mainly focusing upon as to what are the anticholinergic drugs and their uses in the form of simple mnemonics we'll be discussing about. So students and viewers, beginning with anticholinergic drugs. The word itself is suggesting that these anticholinergic drugs, what they are going to do is that they have an action what is going to be anti to the cholinergic, that is the acetylcholine. So the action of acetylcholine. So these anticholinergic drugs, they are going to exert their effect by, they have their action, how they are going to be behaving in an antagonistic way to the neurotransmitter acetylcholine. So whatever are the functions of this acetylcholine, they are going to just inhibit the actions of acetylcholine and they are going to exert their actions. So this acetylcholine, it is a neurotransmitter and it is basically responsible for the parasympathetic action. So this anticholinergic drugs, they exert their effect. How are they going to exert their effect? They are going to exert their effect by decreasing the parasympathetic activities. So this anticholinergic drugs, what are they going to do? They are going to block the acetylcholine neurotransmitter, where in the central nervous system as well as in the peripheral nervous system, and they are going to decrease the parasympathetic activities. That's why they are also called as parasympatholytics, and they are going to evoke a response which is similar to the sympathetic activity. So that's why they are also being called as the sympathomimetic drugs. So since they are going to decrease the parasympathetic activities, they are called as parasympatholytics, and they are going to exert their action in the form as which is very similar to the sympathetic stimulation. So that's why they are also called as, the other name for them is sympathomimetics. Now they allow the sympathetic system to become more dominant, and since they allow the sympathetic system to become more dominant, so our sympathetic system is actually what gets triggered when we are in a situation, in a condition of danger. For example, if we are walking on the road and we suddenly, a dog starts running towards us and it starts barking, and it starts running towards us. So actually the sympathetic system will get activated, and whatever the sympathetic stimulation, the symptoms what it will be produced, that is the increase in heart rate will be there will be drying of the mouth, there will be decreased secretions, all such activities which are resembling when the body is in a sympathetic state. Such actions will be elicited by the anticholinergic drugs. That's why they have also been given the another name, what are called as the sympathomimetics or the parasympatholytics. All right. Now they are going to block they are going to cause the blockage of the parasympathetic nervous system, and since the parasympathetic nervous system is getting blocked, so ultimately that is going to result in a decrease in the secretion, the motility and the peristalsis of the gastrointestinal tract, as well as these are administered, and also they cause the relaxation of the smooth muscles. So they are administered, the effects what are mediated through these anticholinergic drugs, they are mediated by the acetylcholine, and on their effects are mediated how? Since the acetylcholine are going to bind to a specific receptor. So this acetylcholine, when it binds to the specific receptor, it exerts its influence. So this acetylcholine, which is the neurotransmitter, these anticholinergic drugs, they are going to competitively bind with the receptors where the acetylcholine is going to bind. So they are going to cause, these anticholinergic drugs are going to cause the competitive inhibition of the of the cholinergic of the acetylcholine. So they are going to competitively inhibit the cholinergic sites where the acetylcholine is going to bind, and they are going to have they exert their effects which are mediated by the they are going to decrease the effects what are mediated by the acetylcholine, since they are going to bind on the acetylcholine receptor in the neurons by the process what is called as competitive inhibition. So in a normal physiology, where the sites on the neurons, where the receptor sites on the neurons, where supposing this is a receptor site on the neuron, these are the receptor sites, my 4 tips of the fingers are the receptor sites on the neurons where the acetylcholine is going to come and bind and exerts its effect. But the anticholinergic drugs, what are they going to do? Where the site where the acetylcholine is going to come and bind, they are going to exert their influence by going and competitively, they are going to compete with the acetylcholine and bind with those receptors and exerts its effects. So therefore, these anticholinergic drugs, they are administered and they decrease the effects what are mediated by the acetylcholine on the acetylcholine receptor in the neurons by a process called as competitive inhibition. So students and viewers, do remember, they are going to exert their influence through competitive inhibition, and therefore the effects what are caused by these anticholinergic drugs, they are reversible, since the process of inhibition is a competitive inhibition. So the effects what are caused by the anticholinergic drugs, the effects are reversible. So once the drugs are given to the body, they will exert their effects. The sympathomimetic effect they will be exerting, and slowly and gradually as the drugs concentration falls down, the drugs get removed from the body, the effect what is being caused by the action of these anticholinergic drugs, it will revert back to the normal. It will revert back to the original state. All right, so this was a very short discussion, students, where I've given you in simple terms as to what are the anticholinergic drugs and how and where are they going to act, how they are going to act, and what is their effects. So this is a very important multiple choice question, that these anticholinergic drugs, they are going to exert their influence on the acetylcholine receptor by what process of inhibition? It is the competitive inhibition, and their effects are reversible. Students and viewers, do remember. So students, this was a very short discussion. In the next video right now, I'll be discussing about the uses of the anticholinergic drugs, and I'll be relating this introduction to the uses. So students and viewers, stay connected, stay tuned. If you like this video, give this video a thumbs up, and the students who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.